Bring on the sunshine. Millions of Brits fly in and hit Spain's beaches every year. A short hop from home with all the comforts of home. Or so thought Ray and Rosemary Burton when they were last on holiday here. They headed to this public hospital when he became seriously ill. They assumed they could use Ray's European health card called an EHIC. It's supposed to give free access to emergency care in Spain.
We presented our EHIC cards, but were asked for credit cards and then later asked for insurance details. And they were quite firm in not wanting the EHIC card.
It's not just them. One woman went to hospital in Ibiza needing surgery for a twisted bowel. The card wasn't accepted. The hospital is still trying to charge her £21,000. In Alicante, a British couple was charged £2,500 for treating a head injury. Their daughter had to fly back out to Spain to demand a refund, which she did get. Millions of British people come to this part of Spain every single year on their holidays, and the British government says that for most of them, if they have to use these health cards, the system does work. But there is concern about when it doesn't work, and not just for British people, but for holidaymakers from across Europe. That's why Spain's health officials have now been told by the European Commission to fix the system. The Spanish Health Ministry says it's been working properly, but it will cooperate. Far, far away from the sunshine, Brussels today wasn't just pointing the finger at Spain. It's the European Commission's job to police how the EU's single market is working. Today it also said the UK is breaking the law, failing to pay EU migrants living in Britain the benefits they're due. The government says its benefit tests are fair and necessary, but the Commission's taking the UK to court over this.
Well, let's be very clear on this. We want the UK to apply the EU rules against benefit tourism. We're not talking about letting people get access to UK benefits from the day they get off the ferry or get off the plane. It's people who are habitually resident in the UK.
So today, Britain divided on the EU, happy with the action against Spain, less so perhaps about that against the UK. Matthew Price, BBC News, Brussels.
The recent Al-Qaeda attack on a natural gas facility and subsequent hostage situation in Algeria represents some of the extreme dangers oil and gas workers face 365 days a year. Militants stormed the Tiqin natural gas facility near In Amenas with dozens of people killed. Tragically, when Algerian military forces stormed the facility, more fatalities were caused. This dramatic hostage siege has prompted reaction by all oil and gas companies in the region, prompting some to review the situation and consider safer areas of operation. But for those companies and workers who face these risks, how can the oil and gas companies manage such risk and protect their personnel? Minooker Takin, Senior Petroleum Upstream Analyst with the Center for Global Energy Studies CGES in London, told New Europe the oil companies operating internationally are well accustomed to these risks and problems. The oil and gas industry have always faced a myriad of risks relating to field operations and assets security and protection, especially when exploration and production is located in areas of civil unrest or conflict. Changes in regulations have increased the cost of compliance, following incidents like the BP Deepwater Horizon oil spill in the Gulf of Mexico. Tighter health, safety and environmental requirements are requiring larger investments by the industry in order to comply, and to fully protect their workforce from a host of concerns. General rig site safety is one of the most common risks, and day-to-day management is imperative so personnel are fully educated and trained to minimize accidents. Pipeline blasts are also common occurrence at a domestic and commercial level. Just 2 days ago, major media reported unidentified attackers blew up Yemen's main oil pipeline, forcing the country to shut down one of its most lucrative sources of income. Throughout 2011, Yemen's oil and gas pipelines were repeatedly sabotaged by insurgents and tribesmen since anti-government protests created a power vacuum in 2011, causing fuel shortages and slashing export earnings for the impoverished country. On the domestic front, December 11, 2012, a fireball is seen across Interstate 77 in Sissonville, West Virginia, USA, as a natural gas pipeline exploded in flames near Charleston. Blowouts, oil spills and personal injuries are some of the operational hazards faced by oil and gas workers every day. In 2013, the industry is investing heavily in health and safety precautions to ensure it doesn't happen again. Natural disasters and adverse weather conditions from Arctic seas to hurricanes also pose great risk as we drill in deep water. Protecting and caring for the mobile and specialist workforce is of pivotal importance. Sigma Global Health Benefits Europe is one company recognizing the importance of care for specialist remote and mobile workers in harsh and dangerous locations. Oil and gas HR assets can now secure added peace of mind with Sigma's new range of international private medical insurance energy plans. Designed specifically for the oil and gas market, members can select from 3 levels of cover including Core, Advanced and Ultra. Members may also select geographical coverage including worldwide or country-by-country cover, excluding the USA. Providing coverage for chronic conditions as standard and pre-existing conditions, for groups with more than 10 employees, the new IPMI plans cover remote emergency evacuation services to work hand-in-hand with oil and gas companies' offshore facilities.